friends, welcome to Hejar, Stay Medicine. Team Hejar will be taking you through medical lectures. Hejar is a Kurdish word meaning healer and Stay Medicine stands for Master of Medicine. This is our first video. We hope all your supports and blessings for our further moves. So, today we are going through chronic bronchitis. Chronic bronchitis. Chronic bronchitis is a clinical condition. It's a clinical condition characterized by persistent cough with expectoration. Characterized by persistent cough with expectoration. And there is a duration for that. For 3 months of a year. That is for 3 months of a year. And also for 2 or more consecutive years. 3 months of a year and for 2 or more consecutive years. Chronic bronchitis is one of the diseases of COPD. It's a disease among COPD. COPD, that is chronic obstructive pulmonary disease, also known as COAD, that is chronic obstructive airway disease. It's a chronic disease. COPD or COAD is a chronic disease. This term COPD or COAD is commonly used for a group of pathological conditions. It's used for a group of pathological conditions in which there is partial or complete obstruction. In which there is partial or complete obstruction at any level from trachea to bronchiole. A partial or complete obstruction at any level from trachea to bronchiole. The final result of COPD is the functional disability of lungs. The final result of COPD is the functional disability of lungs. So that's a brief note about COPD. Now we are coming back to chronic bronchitis. The cough in chronic bronchitis is caused by oversecretion of mucus. The cough in chronic bronchitis is caused by oversecretion of mucus. Talking about the age group, it seems to be common in middle-aged female than in men. In middle age, females are more prone than male. Whereas in adult, 20% of men and 5% of female are prone to chronic bronchitis. Now we are moving to the etiopathogenesis. The etiopathogenesis of chronic bronchitis. That are the causes of chronic bronchitis. That's the etiology and the pathogenesis. All those things. There are mainly etiopathogenesis. There are 5 factors which leads to chronic bronchitis, in which 2 of them are main causes. The main causes are smoking. The first main cause is smoking and air pollution. The other contributory factors are infection, occupation, and genetic and familial factors. And familial factors. Um, Looking for a brief note, smoking. The first cause is smoking. It is the most common cause. It is the most common cause. Yeah, it's very common cause of chronic bronchitis. Cigarette smokers, heavy cigarette smokers are 4 to 10 times higher prone to chronic bronchitis. They are 4 to 10 times higher prone to chronic bronchitis than others. Second one is air pollution. Air pollution is also a common cause in urban area. It's a common cause in urban area. Toxic fumes, dust, chemicals, etc. cause air pollution, which leads to chronic bronchitis. The air pollution is caused by toxic fumes and all, and the air pollution causes chronic bronchitis. Third one is infection. Usually infection occurs secondary to bronchitis. It is a secondary cause to bronchitis. Increased mucus secretion results in occlusion of respiratory tract, which in turn favors bacterial growth. Thus, secondary bacterial infection occurs. That's due to the occlusion of respiratory tract. Now, the fourth cause is occupation. People working in cotton mills, plastic and mining factories are prone to chronic bronchitis. Cotton mills, plastic and mining factories are prone to chronic bronchitis. The obstruction caused by cotton is byssinosis. The obstruction caused by cotton, that are the people working in cotton industry, that is known as byssinosis. The fifth cause is familial and genetic factors. Now, while moving through the morphological features, we'll come across two different types. They are gross and microscopic. Morphology, we have gross and microscopic. Microscopic. The gross appearance of chronic bronchitis are, first, the changes that occur to bronchial wall. The changes that occur to bronchial wall are, it becomes thick. Hyperemic. There will be hyperemic and edematous. That are the changes would occur in bronchial wall, while in lumen may contain mucus plugs and exudate. That's all about gross appearance. Now going through microscopic appearance. Reed index increases. That's a main feature of microscopic appearance in chronic bronchitis. Reed index increases. Reed index is a ratio between the thickness of submucosal gland to that of total bronchial wall. Thickness of submucosal gland to that of total bronchial wall. Next topic we are moving to is the clinical features. The clinical features of chronic bronchitis. The first one is, as told in the definition itself, persistent cough with expectoration. Persistent cough with expectoration. And the second clinical feature is that initially it will begin as morning cough or throat clearing. Initially it begins as morning cough or throat clearing. Throat clearing. And the next one is recurrent respiratory infections are common. Recurrent respiratory infections are very common in chronic bronchitis. And dyspnea. Dyspnea will be there on exertion. Dyspnea, a difficulty in breathing, will be there on exertion, like if the person go for any work or something like that. The other one, it's an important clinical feature of chronic bronchitis, that is blue blotters. Blue blotters is a combination of cyanosis and edema. That's a characteristic feature of chronic bronchitis. Cyanosis plus edema. And in chronic bronchitis, we can see the features of right heart failure. We can see the features of right heart failure in chronic bronchitis. Right heart failure. And while we are examining the X-ray, enlarged heart with prominent vessels. The heart will be very enlarged and the vessels will be very prominent in the X-ray of a patient with chronic bronchitis. Yeah. Now let's go through the chronic bronchitis once again. Yeah. Chronic bronchitis, simply going through the definition, it is a clinical condition characterized by persistent cough with expectoration for 3 months of a year for 2 or more consecutive years. And it is a disease of COPD, which is also known as COAD. Then the cause of the cough in chronic bronchitis is because of the oversecretion of mucus. And when we go through etiopathogenesis, 2 of them are the major one or important. They are smoking and air pollution. Others are infection, occupation, and genetic and familial factors. Now if we move to the morphology, we have 2, gross and microscopic. In gross, the changes occur for bronchial wall and lumen, and in microscopic, reed index increases. And we have clinical features which include persistent cough with expectoration and morning cough. It may begin as morning cough, and recurrent infectious diseases are common. Respiratory infectious diseases are common. Dyspnea on exertion, and very important one, blue blotters, which is a combination of cyanosis plus edema. And that is cyanosis and edema. And right heart failure, the features of right heart failure are also seen. In X-ray, enlarged heart will be there with prominent vessels. And that's the end of today's video. For notes, visit Hejar Stay Medicine on Instagram. If you liked it and if you found it helpful, do like and share our video and subscribe our channel. Thank you. Have a nice and big